Vitamin B6, also called paradoxine, is one of 8 B vitamins. All B vitamins help the body convert food, carbohydrates into fuel, glucose, which is used to produce energy. Vitamin B6 helps the body make several neurotransmitters, chemicals that carry signals from one nerve cell to another. These B vitamins, often referred to as B-complex vitamins, also help the body metabolize fats and protein. In this video, we are going to discuss vitamin B6 deficiency versus too much vitamin B6. The video is going to be amazing, so make sure you stick to the end. Before starting the video, be sure to smash the like button and subscribe to never miss out on any of our videos. Along with vitamins B12 and B9, folic acid, B6 helps control levels of homocysteine in the blood. B-complex vitamins are needed for healthy skin, hair, eyes, and liver. They also help the nervous system function properly. It is needed for normal brain development and function and helps the body make the hormones serotonin and norepinephrine, which influence mood, and melatonin, which helps regulate the body clock. A known side effect of vitamin B6 is peripheral neuropathy, which has symptoms of tingling, burning, or numbness, usually in the hands or feet. It usually occurs at high doses or following long-term use of products containing vitamin B6. Peripheral neuropathy is not associated with normal dietary intakes of vitamin B6. Growing evidence from experimental and clinical studies suggests that systemic inflammation underlying most chronic diseases may impair vitamin B6 metabolism. Although supplementation with vitamin B6 and other B vitamins have not been associated with improved cognitive performance or delayed cognitive deterioration in the elderly, recent studies suggest that vitamin B6 might help reduce the risk of late-life depression. Pharmacologic doses of vitamin B6 are used to treat seizures in rare inborn errors of vitamin B6 metabolism. Also, randomized controlled trials support the use of vitamin B6 to treat morning sickness in pregnant women and suggest a possible benefit in the management of premenstrual syndrome and carpal tunnel syndrome. Vitamin B6 is found in a variety of foods, including fish, poultry, nuts, legumes, potatoes, and bananas. Because vitamin B6 is present in many foods, the deficiency rarely results from inadequate intake except in severe malnutrition. However, deficiency can also occur because extensive processing can remove vitamin B6 from foods. Vitamin B6 deficiency is common among people who have had a severe deficiency of protein and calories, protein, energy, undernutrition. People with this disorder do not consume enough vitamin B6. On the other hand, taking very high doses of vitamin B6 may damage the nerves, called neuropathy. People may be unable to tell where their arms and legs are, position sense, and to feel vibrations. Thus, walking becomes difficult. The diagnosis of vitamin B6 toxicity is based on symptoms and a history of taking high doses of vitamin B6. What's the point of talking 100 milligrams or 50 milligrams? Najafi says, pointing to a recommended daily amount that is 2 milligrams or less, yet he says megadoses of 50 mg to 500 mg are widely available. Over the counter, he suggests a warning label that says this medication may be dangerous when used in large amounts or for a long time. Stop taking this medication if you experience tingling, burning, or numbness, and see your healthcare practitioner as soon as possible. Vitamin B6 plays an important role in mood regulation. This is partly because this vitamin is necessary for creating neurotransmitters that regulate emotions, including serotonin, dopamine, and gamma-aminobutyric acid, GABA. Vitamin B6 may also play a role in decreasing high blood levels of the amino acid homocysteine, which have been linked to depression and other psychiatric issues. One study in 250 older adults found that deficient blood levels of vitamin B6 doubled the likelihood of depression. Signs that you lack B6 can show up in your skin. Your body goes through chemical changes that most often leads to scaly, itchy rash, usually on your face, called seborrheic dermatitis. The rash may get more and more obvious with time. If you have a minor shortage, the symptoms could take months or years to show up. Your mouth could be a good place to spot any shortage of B6. Your lips might be scaly, and the corners could be cracked. Your tongue might swell. A shortage of B6 may make it harder for your body to resist infections and diseases that can turn into a vicious cycle. Cancer and other illnesses can deplete your B6 supply. One clinical study found that 25 mg of B6 taken daily as part of a B-complex vitamin was shown to increase the risk of heart attack, stroke, and death in diabetes patients with advanced kidney disease. Also, be aware that people taking certain medications may need to limit their intake of B6 from supplements. Paradoxine is used not only to treat and prevent vitamin B6 deficiency, it is not clear how vitamin B6 might affect heart disease. People who do not get enough B6 in their diet have a higher risk of heart disease, but scientists do not know exactly what the relationship is. They also do not know whether lowering levels of homocysteine will reduce your risk of heart disease. Until more is known, the best action is to get enough B6 through food and to take supplements if your doctor recommends them. One large study found that women who took 50 mg of vitamin B6 daily, along with 1000 mcg of cyanocobalamin, vitamin B12, and 2500 mcg of folic acid reduced their risk of developing AMD, an eye disease that can cause vision loss. Research on vitamin B6 and breast cancer also shows an association between adequate blood levels of B6 and a decreased risk of disease, especially in postmenopausal women. If you take B6 in tablets or in foods within 6 hours of going to sleep, you may be getting up to urinate every few hours during the night. For some men, the problem isn't the prostate, but this vitamin. Those energy drinks are overloaded with B6. A review study reports that taking paradoxine may help with mild symptoms of nausea and vomiting during pregnancy compared with a placebo. Based on the research, the American Congress of Obstetricians and Gynecologists (ACOG) recommends vitamin B6 supplements as a safe, over-the-counter treatment for nausea during pregnancy. A study published in 2017 indicated that vitamin B6 may help to protect people against the harmful effects of air pollution by reducing the impact of pollution on the epigenome. The researchers hope their findings may lead to new measures to prevent epigenetic changes that can result from exposure to air pollution. The World Health Organization reported that in 2016, 91% of the world's population was living in places where official air quality guidelines levels were not met. A group of more than 85,000 women without a prior history of kidney stones were followed over 14 years, and those who consumed 40 mg or more of vitamin B6 daily had only 2/3 the risk of developing kidney stones compared with those who consumed 3 mg or less. Limited experimental data have suggested that supplementation with high doses of paradoxine may help decrease the formation of calcium oxalate kidney stones and reduce urinary oxalate levels, an important determinant of calcium oxalate kidney stone formation. There is no need for a warning label on vitamin B6, says spokespeople from two industry groups that issued statements in response to the petition. Vitamin B6 plays a role in numerous functions in the body and can be safely consumed from foods and dietary supplements, says Andrea Wong, PhD, a senior vice president at the Council for Responsible Nutrition. The tolerable upper intake level of vitamin B6 is 100 mg in adults, based on the risk of sensory neuropathy. However, research indicates that sensory neuropathy usually develops at far higher doses. We encourage individuals to talk to their healthcare providers about what levels of vitamin B6 are appropriate to support their health. Low levels of vitamin B6 have been associated with RA. Some studies also suggest that people with RA may need more vitamin B6 than healthy people because chronic inflammation may lower B6 levels. Eating a healthy, balanced diet and taking a multivitamin is a good idea for anyone who has a chronic illness, such as RA. Compared to women who had the lowest intake of both vitamins, women who had the highest daily intake, at least 35 mg of B6 and 20 mcg of B12, were 47% more likely to have hip fractures during the study. Vitamin B6 may improve symptoms of tardive dyskinesia, is a side effect of long-term use of antipsychotic drugs and involves involuntary movement of muscles such as the tongue, lips, face, and jaw, arms, legs, fingers, or toes. Many people take supplements without clear indications, and high-dose vitamin supplements are readily available in drugstores and on the internet, said lead study author Dr. Håkon Meyer on the University of Oslo in Norway. Our results add to other reports suggesting that high-dose vitamin supplementation can lead to unexpected adverse effects. Meyer said by email, normal intakes of these vitamins corresponding to recommended dietary allowances were not associated with increased fracture risk. Let us know your opinion in the comment section below. This was all for today. Hope you liked the video. Do not forget to subscribe to our YouTube channel. Stay safe, and we'll be back soon with another video. Please click on the next video clip to watch for more health info. Thank you very much.